You're having a big impact on mental health. You're having a potentially big impact on domestic violence, and we were starting to see those figures in suicides and possibly child abuse and molestation. So there are many other things that are byproducts of these lockdown restrictions, which I just do not think were being incorporated into those initial models.
You're listening to the Deep Trouble podcast. Dr. Mark Halloran in conversation with Professor Gigi Foster from the School of Economics at the University of New South Wales Business School.
My understanding from what you said was that even if the models, the projected models, which I think some of them were released by the Doherty Institute, even if they were correct and we reached numbers like 50,000 deaths, 150,000 deaths, that it still might not be worth a severe lockdown, even if we attain those numbers.
That's absolutely right. And another reason for that is because when you talk about severe lockdown, you're talking about the restrictions that came in place in Australia after our daily infection rates peaked. And so if you look at it from a logical empiricist standpoint, the lockdowns came after the peak infection. So it cannot be that the lockdowns caused infections to peak, right, to start going down. That's not how it works, actually, in empirical reality, right? And so there are many, many restrictions and advice, encouragement that could have been put in place that did not involve that full lockdown. Indeed, I don't think that schools should have closed, but there were some sensible things. Certainly the hand washing, and advice about where to sneeze and stay home if you're sick. That's always sensible and very much sensible in this case. I would never have stood against that. And in fact, I did not ever say on Q&A that we should have always kept our borders open. I think there was a reasonable case for the prevention of easy access into Australia from people who were coming from countries that were having a really extreme epidemic at that particular moment, for a month period or whatever. And I certainly think that the cruise ship situation could have been handled a bit better, right? So, but those are targeted measures. Those are measures that, in my view, are proportionate to the threat that we were facing. Whereas what we actually saw in terms of policy was, some measures that looked pretty targeted. I mean, JobKeeper is pretty targeted to try to assuage the damage that we caused to ourselves. And so I'm a big JobKeeper program supporter. But what we also saw were these blanket policies, which really were not proportionate to the threat at all, and indeed may have done very little to stem those death rates.
I think there's a point in here that I'd be just interested in what you think about this. So Sweden went another way and resisted locking down. They currently stand, the last time I looked at 46,814 cases and 4,795 deaths. And Anders Tegnell, the leading epidemiologist who spearheaded their response, is now reportedly backtracking and stated that he'd do it differently. It's 43 deaths in 100,000. I mean, if you look at other just diseases like neurological diseases, something like motor neuron disease is like 1 in 100,000. And this is in a country of 10.23 million people, whereas the COVID elite countries, like places like Taiwan, which has a population of 23.78 million, has 443 cases and 7 deaths. But culturally, it's very different to Australia. So they had gone through SARS and MERS, and it is I guess the public are used to restrictions. They're used to face masks. They're used to social distancing and using hand sanitizer. And I wonder with Australia, just because we're culturally different, the extreme measures were put in place because Australians wouldn't respond in the same way as the population from Taiwan.
Well, I mean, I think we certainly didn't have the infrastructure in place, as you say, that Taiwan did because of their previous experience with SARS and MERS, and we also perhaps didn't have as much population readiness. But to be honest, that sounds to me like a bit of a patronizing kind of explanation. I mean, the idea that we must close schools in order to frighten people, that's the opposite direction from what the government should have been doing. It should have been messaging to contain and reduce fear and put this threat in proportion, which is, by the way, what the Swedish government have done all throughout this crisis, is they have provided messaging with perspective. They have provided reasoning behind their decisions, such as not to close schools because children are not a vector for this thing. And if you close schools, you put kids back in homes and make those adults then unable to go to work or be as productive when they are working. Now, I'm not going to claim that the Swedish people, and I'm sure that Tegnell would agree with this, that they have done exactly the right thing. I mean, I think he would admit, in terms of the backtracking you're speaking of, I think that's mainly in regard to how how the old people's homes were treated. And I think they realized that, okay, if you send all the old people into one place and then you don't test really rigorously everyone who's in contact with that place, and you don't have, creative solutions that don't impinge on old people's freedoms but do protect them, then you could very easily create a greenhouse kind of situation where if the virus gets in, it runs rampant. And that's very much what Sweden has seen, is the vast majority, even disproportionately more than in other countries, of their deaths have been in old folks' homes. Now, of course, that basic pattern of higher lethality of this virus in older people than in younger people is something we knew back in mid-March. We've known this for a long time, right? This virus is like a wolf. It preys on the most vulnerable in the society, the older people, the immunologically compromised people. Which is not to say that you cannot get it or you can't have severe symptoms at all if you're younger, but the risk is orders of magnitude less. And indeed, the case fatality rates you were quoting earlier, those are a bit on the high side compared to my most recent data. I would think, based on what I've seen and what I'm weighing up, probably a case fatality rate of about 0.4% is roughly where we're at now. But even then, remember that testing is, incomplete in many countries. And so, if you have a large degree of asymptomatic cases, that pushes down your rate. So I actually think that, yes, okay, Sweden has lost more people. That's exactly what you'd expect. Their policies compared to others. But if you look across countries, indeed, the countries that really locked down heavily, in some cases, have had just as bad, if not worse, rates of infection. Those that didn't lock down, Belgium is one example. And one of the benefits of having a broader suite of people who are infected with this thing in the first wave is that you've got more immunological defense against it then in future periods. And we don't know whether this is going to have a second wave.